Hello, Dr. Tatyana Borisiak with Fuse Vitality and
Beth Panoff of Arcadia Institute.
we're here to continue our brain series on sleep, and we're happy to have you in our studio. So, Beth, welcome back. Welcome back.
Thank you.
So, you
Thank you.
promised to talk to us about several supplements that you're using with your sleep treatments. And could you tell us a little bit more about it?
Sure, absolutely. It's good to be here. So first of all, when I work with patients who state they have sleep issues, one of the really important things for me to do is to assess, first of all, why they're having the sleep issues, because it may be that they're falling asleep and they wake up, or they're having trouble falling asleep, their mind is racing, there's their partner snoring, or they're getting up to go to the bathroom. So really, the first thing for me to do is to really assess like what's going on with the sleep. So what I wanted to focus on today with our brain series is a couple of supplements that I utilize in patients who are, just sort of really stressed out and having trouble sleeping because they're either overtired, or they're athletes that are overtrained. They're stressed out people, busy, or having a lot of anxiety, and they're just laying in bed wide awake and their mind is racing. It's a term that I like to call the monkey mind, where it's just going. They can't shut it off, and so they can't sleep.
So basically, those are people who cannot fall asleep.
Yeah, and they can be exhausted, but they get in bed and they just lay there and they're wide awake, And so, of course, assuming that we have their hormones balanced, we, set the sleep, set the stage for sleep a couple hours before, the sleep hygiene, things that we mentioned last time. Of course, assuming all of that is in place, if this is the issue, this is when I really like to go to a couple of these supplements. And usually what I do is have the supplements in a formula. So I don't generally use just one supplement. It's a combination, of course, because then they enhance, the effect of the other ones. And so they work better. And so two of those supplements are, one is GABA and the other one is L-theanine. And I'm sure you've heard of them. I'm sure a lot of the audience has heard of them. The reason I like them is because of how they work in the brain. L-theanine actually is an amino acid, and it's found in green tea leaves and black tea leaves. And so it is a natural substance, and it, just like GABA, it doesn't knock you out. It doesn't make the person just fall over and fall asleep. It doesn't necessarily make you drowsy, but what it does is it calms the brain down. So it works at the neurotransmitter level and just sort of relaxes the brain, eases the anxiety and the fears. And so that way the person is more likely to be able to fall asleep. So even drinking green tea, that's why, assuming it doesn't have caffeine in it, is going to be relaxing also.
Right. So are you talking about the extract supplements, not actually drinking a tea, because that will definitely keep you awake at night.
Right. And it also can, even though it's used for sleep, it also has some neuroprotective benefits. So it actually, can help the brain and also can help focus, even though that sounds a little bit opposite. But because of the way it works with the brain in calming it down, it enables the focus to be better. But when we're working with someone for sleep with a sleep formula, that calming effect enables that person to be able to fall asleep better.
Right.
Yeah. So, and so the other supplement is GABA. And so GABA works in a similar way as well. It works, it's a neurotransmitter. It balances the other neurotransmitter in the brain, which is glutamate, which is an excitatory neurotransmitter. So, if you have too much glutamate, the brain is like hyperactive, like kind of on fire. I think of when I think of glutamate, I also think of like the food additive MSG, which has glutamate in it. And, and so we know that the effect that has especially with kids and adults, but especially with children, is to get them like hyperactive, overexcited, and even in some cases, hyperactivity, and that excess glutamate can contribute to seizures. So the GABA is that balancing effect. It calms that down. And a lot of people have heard of that medication, gabapentin. which is used for pain, also,
Neuropathy,
yeah,
pain.
yeah, sometimes restless legs, and also for sleep. It makes you really drowsy. So that's actually an analog, a derivative of the GABA.
Oh,
So,
of course, in a more gentle way, I would
right.
assume. Correct.
Absolutely.
Yes.
Yeah. It's not like the medication. It's just, that's sort of the similarities there. But the GABA is very gentle, as is the L-theanine. And again, it's not like you're going to take it and it's going to put you to sleep, but it has that calming effect. Usually the combinations in the supplements has the GABA, L-theanine, sometimes like chamomile, valerian root, melatonin, things like that. So they hit different areas to promote sleep, restful sleep. And of course, we know how important sleep
So,
is.
who would be the perfect candidate to those two particular supplements, and why would you recommend both of them, or to who you would recommend only one or the other?
I think it really
Like, from
depends.
your own experience. From your own experience.
Yeah, I mean, I have used, them individually for people, especially if they're waking up and they're just feeling like they can't fall asleep. Sometimes L-theanine is useful for that because it's just that calming effect. And if so, for some people, that's all it takes, and they sleep well. Um, but generally, when someone's having trouble sleeping, I like to put them together, because of the added effect of the other formulas, the other,
Correct.
supplements. And for that, I usually find like people who are just very, very busy, working really hard, stressed, or especially anxiety, where they're laying down in bed and they're worrying about everything that's going on, and they can't sleep because of that. And definitely people who are training hard or overtraining, because they
Right.
just have that, that sympathetic overdrive, and they have a hard time falling asleep.
So, why would you give preference for those supplements as opposed to medications that are like benzos?
Well, the nice thing about the GABA, these supplements is especially the GABA, it actually hits the same receptors in the brain as like the benzodiazepines, like Valium and Xanax and those, but it doesn't knock you out as much. It doesn't have also that really sedating effect. It doesn't give you that, like, that hangover in the morning that a lot of people
I was
get from
about
the
to say that
benzos. Yeah,
brain fog,
yeah,
that drowsiness in the morning
yep.
that people would experience after they take
Yeah.
benzodiazepines.
And generally they won't with this. But the other thing is, I always suggest for patients, if it's their first time trying the formulas or trying even the one supplement, to try it when they don't have to be up super early and like on point right away in the morning, just in case, because like with any new supplement or new medication, you want to see how you're going to react to it. And so it's best to take it, like, say, on a weekend when you're not having to jump up and go to a meeting, or something where you have to be really
Right.
on point right away, just to see how you feel. And then once you know how you react to it, then you just take it nightly.
Right. So yeah, definitely, and it doesn't create that dependence as well as you would
Absolutely.
have on a
Yeah.
benzodiazepines.
Right.
So you can skip the night, and so you could use it occasionally. You can use it more or
Hmm.
less on a daily basis, but
Yeah.
it does not create that dependence effect or rebound insomnia.
Right.
Sometimes you would see for people who are using
Yeah.
benzodiazepines.
Exactly. Yeah, it's not associated with any of those, and I'm not opposed to using the prescriptions. I mentioned in the last episode that I don't use them. And there are situations, of course, where you do need to use them if someone's really not sleeping and they need to get some sleep. Sure, short course, but I really prefer to use the supplements and really transition them from the medications to the supplements, preferably, because they're so, for the reasons we just stated,
Right, right,
less side
definitely.
effects.
So where would you get them? Tell me, please.
Well, I normally suggest for my patients to really make sure they know where they're getting their supplements. Not all supplements are created equal. You really need to know where they're coming from. And like, a lot of people will get their supplements at the drugstore, and I don't normally recommend that, only because there's a lot of extra fillers and things that you don't necessarily want in your supplements. And then
Correct.
you also don't know how much is actually of the active ingredient that you want. And so I'm really feel strongly about getting your supplements usually from a practitioner, or from
From a
someplace where
reputable
you can get
source, correct.
quality source. Yeah, absolutely. I use different companies that are pharmaceutical grade. I use Full Script, for a lot of my supplements. And that's normally where I like my patients to get the supplements from. I always tell them they don't necessarily have to get them there, but we want to make sure that wherever they get them, they're quality, because it makes a big difference, as you know.
Absolutely.
Yeah.
So, okay, very good. So yes, so definitely if any of our patients or anybody who has any questions about those particular supplements, or maybe make any other comments or suggestions for our future talks, please feel free to make some comments, access our website at the link in bio. We'll be happy to discuss any further questions and answer further questions, and for the in regards to sleep in our future discussions. So Beth, I think at this time we probably will be wrapping up.
Okay.
And it was so great to have you here, and I'm looking forward to our next session,
Thank you.
continuation of sleep uh, 3. Will we
Thank you.
introduce a few other supplements that can be used and discuss it in more detail and further, and what combinations can be used and how are they tailored to particular person. I think that's most exciting. So
That sounds great.
any
Thank
other
you.
questions, any other comments, Beth, before we wrap up?
No, I think that's it for tonight. I look forward to our next series, and just giving more information on how people can sleep better, and more top to come. Excited. Thank you so much.
Bye.
Bye.